Hi students, you are welcome to Angel Health Academy. Topic for the day or topic for the session is IPHS for Subcenter, Indian Public Health Standards for Subcenter. So today I would like to talk about the IPHS 2020, the latest IPHS version, that is a standard for maintaining the quality services in the subcenter, and moreover it is one of the important topic in community health nursing. So let us discuss about IPHS standards, latest standards for subcenter. Healthcare delivery services or delivery of healthcare services through the public health sector. Public health sector means government agencies, government health sectors. Okay, government healthcare agency in India follow three-tier structure. Okay, I have been already uploaded a video about the primary level, secondary level and the tertiary level care. If you have not watched that video, you can go through that for better understanding about the primary, secondary and the tertiary healthcare services. So, delivery of health services in government health sectors has been done at a three-tier structure. There are three sections, that is primary, secondary and tertiary health care services, and these services are rendered by the public health sector such as sub-center, primary health center, community health center, sub-district hospital and district hospital respectively. So primary health care will be given sub-center and primary health center, secondary care will be given community health center and sub-district level, and tertiary care is given district hospital or by district hospital, okay, respectively. And these services, sub-center, primary health center, community health center, sub-district hospital and district hospital are given both in a rural area and urban area of the country. Then to facilitate the programs in NRHM, you know that National Rural Health Mission, Government of India launched in 2005. To facilitate that, to arrange the facility to render the or to fulfill the objectives of NRHM, that is National Rural Health Mission, and to ensure the quality services through the public health sectors or public health agency or government health services in the country, Ministry of Health and Family Welfare developed Indian Public Health Standards, that is IPHS, Indian Public Health Standards for all the public health sectors in 2007. So the first important point is Government of India rendering health services, that is primary, secondary, tertiary level services by sub-center or through sub-center, primary health center, community health center, sub-district hospital and district hospital, both in rural and urban area. And to make the facility in these health centers under NRHM, National Rural Health Mission, and to render the quality services through this sub-center, primary health center, community health center, sub-district hospital and district hospital, Ministry of Health and Family Welfare developed a standard that is called the Indian Public Health Standards for these health centers or public health sectors in 2007. Thus, IPHS are a set of uniform standards. So, it is a standards. Okay, so it is a set of uniform standards. Uniform standard means wherever you go in the country, you will be available same quality service from these health sectors. Okay, sub-center, primary health center, community health center, district hospital, subdivision hospital, etc. So IPHS are a set of uniform standards and an important tool. So it is a tool to achieving the quality public health care delivery services and better health outcomes, that is achieving universal health coverage, that is UHC. So to achieve the universal health coverage and to facilitate the NRHM, Government of India started IPHS standards, or Ministry of Health and Family Welfare launched IPHS standards in the public health care system or in the public health agencies or health centers and hospitals. Then later it was revised. So two times it was revised. The first time in 2012, okay, and second time recently, that is in 2022. So today I would like to talk about that recent IPHS standards in 2022 for sub-center. Okay. So this is about the introduction towards the topic, that is IPHS standards in India. So it was launched in 2007 and later it was revised in 2012 and recently it was revised in 2022. So now let us talk about Indian Public Health Standards IPHS 2022. So Ministry of Health and Family Welfare revised IPHS guidelines in 2022 for the district hospital and the sub-district hospital, that is for SDH and DH, and for the community health center and PHC after Ayushman Bharat, it is known as Health and Wellness Center. So Health and Wellness Center or primary health center, and health and wellness center, that is sub health center or sub center. So IPHS 2022 is the guidelines or standards for sub health center or sub center, primary health center, community health center, and sub-divisional hospital or sub-district hospital and district hospital in India to render the quality services. Then sections of IPHS 2022. So when you go through in depth of the IPHS standards 2022, we'll see 8 important sections. So IPH guidelines have been uniformly framed with 8 sections. So all the IPH standards, even in sub-center, primary health center, then community health center, sub-divisional hospital and district hospital, we have 8 sections. Okay, those 8 sections are, first one is they have written about the background of the IPH standards, then introduction of the topic, for example, why it is revised for the sub-center and what is the reason. Okay, introduction, then objectives of the IPH standards for the sub-center. Then fourth one is types or categories of the health centers. So classification of health centers, then population norms or population coverage of that particular health centers, the particular health center, then general principles has to be followed by the health centers, then criteria for compliances to maintain the standards in an actual setting. What are the criteria has to be followed by the health centers, that is criteria for compliance, and what are the different services is provided and infrastructure must be available in the particular health center to maintain the quality health services. Thus, there are 8 sections in the IPHS standards 2022. Section 1 background, section 2 introduction, section 3 objectives, section 4 explained about the types or categories or classification of the health centers, section 5 population norms or population coverage of the health center, section 6 general principles to be adopted by the states and union territories where that health centers belongs. Then section 7 criteria for IPHS compliance or actions. Okay, for the implementation, what are the criteria has to be followed by the health centers, and section 8 different services provided or rendered by the health centers. Then after that we have 12 different annexures related to the IPHS guidelines 2022 of the particular institution or health center. Now let us talk about Indian Public Health Standards IPHS 2022 for sub-center. So IPHS standards for sub-center. As I have already discussed or mentioned, IPHS standards 2022 has 8 different sections. First section is background about the topic of that IPHS standards. So that gives a summary of the importance of strengthening primary, secondary, tertiary healthcare level services in India, and especially for the importance of strengthening sub-health center in India for the rural population. And the second section is introduction section. It includes the rationality. What is the reason behind revising this IPHS from 2012 to 2022? Okay, why it is revised, and it also explain about the how IPHS can accelerate, increase the India's progress in rendering healthcare services, thus achieving the universal health coverage, that is UHC, and sustainable development goals of sustainable development. Okay, that is the things are mentioned under introduction section 2. The third section is objectives of IPHS 2022 for sub-health center. So section 3 covers the objectives. So first objective is to define uniform benchmark. So uniform standards. Benchmark is nothing but standards to maintain the uniform the services. So similar services or quality services in all the sub-centers in the states and territory of India. So to define or to maintain uniform benchmark, that is objectives of IPHS 2022 first. Second is to specify the minimum assured services. So the services in the health centers are classified into essential services, that is basic services, and desirable services. Desirable services means it can be even give that services also, but there should be minimum these essential services. So in this IPHS standards specify, it is clearly mentioned what are the minimum assured or essential services to be given by that health center or what are the achievable or desirable services also can be given by the health center, particular health center. Then third objective is to provide guidance on health system strengthening components. So actually it is intended to strengthen the health services through the health system. So it is given the guidelines and guidance. Okay, it is the guideline or it gives the guidelines to strengthen the health services by the health centers. Then the fourth objective is to achieve and maintain an acceptable standard of quality of care. So maintain the acceptable standard, minimum standard. So to achieve and maintain the or continue the same quality, okay, acceptable standard of quality of care at sub-health center or sub-center. The fifth objective is to facilitate monitoring and supervision of the various health facilities available in that sub-center or sub-health center. So to facilitate monitoring. So it is easy to monitor by checking the IPHS standards, whether the sub-health center or sub-center is following the standards. That can be monitored by evaluating the IPHS standards, whether they are following the IPHS standards 2022. So to facilitate monitoring, that is continuous evaluation and supervision of the available facilities, supervision of the services rendered by the sub-health center. So that is the fifth objective of IPHS 2022 for sub-health center. The last one is, sixth one is to provide guidance and tools. So actually we have already discussed it is a guideline. IPHS standard is a guideline. Thus it gives the guidance to the sub-health center to render the services, or the health personnel in the sub-center to render the quality services based on the guidelines of 2022, and it is a tool to measure the quality assurance of the or standard healthcare services in the sub-center as per the IPHS 2022. So maintain the uniform standards or uniform services, that is uniform benchmark. Then specify what is the essential services and desirable services in the sub-health center or sub-center. Then provide the guidance on health system strengthening components. So provide the guidance or guidelines for strengthening the sub-center health services. Then to achieve and maintain the acceptable standard or quality of the services in the sub-center or at the sub-center. Then fifth one is to facilitate or continuous monitoring and supervision of all the services and facilities available in the sub-center under IPHS 2022 guidelines or based on its guidelines. The last one is to provide the guidance and act as a tools for evaluation of the success and effectiveness of the sub-health center under quality assurance. So these are the 6 important objectives of IPHS 2022 for sub-health center or sub-center. Next is section 4, that is types or categories of health wellness centers. Types or categories of health wellness centers. So you can see a table here. In that I have given section 4, section 5 and section 6 of IPHS 2022. Okay. So first is section 4. So name of the center after Ayushman Bharat, the sub-center is changed its name or its name as Health and Wellness Center, Sub-Health Centers. Health and Wellness Center, Sub-Health Centers. So that is HWC, SHC. Okay. Then types or categorization. So formerly we had a sub-center only in rural area, but after the launch of Ayushman Bharat, it has got 2 health centers, sub-health centers. In rural area it is known as Health Wellness Center, Sub-Health Center. In urban area it is known as Urban Health and Wellness Center, that is UHWC, Urban Health and Wellness Center. Okay. Then next is section 5 is, that is about the population norms or population coverage of the sub-health centers. Okay. Health and Wellness Center, Sub-Health Center, that is in plain area, okay, general area, Health Wellness Center, Sub-Health Center in rural area, it cover 5,000 population. Okay, the same population only. There is no change of population of sub-center in the rural area, only the name is changed. Hilly, tribal, backward area, Health and Wellness Center, Sub-Health Center cover the population of 3,000. Okay, so in the rural area, if the area is a plain area or general area, the sub-center cover or sub-health center cover 5,000 population, that is one sub-health center. Then in hilly, tribal, backward area, other remote area, that covers only 3,000 population, that is one Health and Wellness Center, Sub-Health Center cover 3,000 population. But in urban area, that is a new health center, urban health and wellness center, UHWC covers the population between 15,000 to 20,000. So in urban area, health and wellness center, sub-health center covers a population of 15,000 to 20,000 and its name is Urban Health and Wellness Center. Then regarding the number of bed availability in the sub-health center, okay, actually there is no inpatient services both in rural and urban health and wellness center in India. Okay, there is no inpatient services, only OPD or outpatient services are available at present. Then section 6 is general principles. So general principles has to be followed by the sub-health center. So both health wellness center, sub-health center and urban health wellness centers both in rural and urban area has to provide comprehensive primary care services, comprehensive primary health care services. So there are 12 components in comprehensive primary health care. I have already uploaded a video about the comprehensive health care. If you have not seen, you have to see that, you have to watch that. That is an important topic under Ayushman Bharat, okay, comprehensive primary health care. So both the sub-centers, both in urban area and rural area, has to provide comprehensive primary health care with 12 components. Okay, that is the general principles discussed under section 6 of the 2022 IPHS standards for the sub-health center. Section 7 is criteria for IPHS compliance. Criteria for IPHS compliance. Compliance nothing but action. To act as per the guidelines of IPHS, there should be, or health center, sub-health center should be follow certain criteria. So for any public health facility including health wellness center to be considered as a compliant with the IPHS norms is nothing but IPHS standards, rules and regulations. A minimum standard for both quantity and quality of services should be achieved. Okay, so as per this guidelines, a minimum standard, that is both in quantity of service, that is number of services rendered by the sub-health center and the quality of the services. So both number of services and quality of services should be achieved a minimum standards. So there are 5 criteria as been mentioned in the IPHS 2022 for the IPHS compliance. First one is to render the essential services. So already we have mentioned in the objectives, there are essential and desirable services has to be rendered by the sub-health center or any health center. So maintain the essential health services in the sub-health center or health and wellness center, sub-health center. Then maintain the infrastructure as per the IPHS standards 2022. So second one, infrastructure. Then third criteria is human resource or population coverage of manpower for health services in the sub-health center. The fourth criteria is medicines. Okay, the different medicines or type of medicine has to be issued by the sub-health center, and the equipment, minimum equipment available in the sub-health center as per the IPHS 2022. So these are the 5 criteria for maintaining the compliance or inaction with the IPHS standards by the sub-health center. First one is to render essential services, maintaining the adequate infrastructure and maintaining the adequate manpower of human resources or health personnel in the sub-health center, maintaining the adequate medicines, okay, supply of medicines, and maintaining the adequate equipment as per the IPHS standards 2022. Then section 8 is service provisions. So what are the services has to be provided, what are the infrastructure is necessary, etc. All comes under section 8. So the section 8 includes the details of the health facilities of the sub-health center or health and wellness center, sub-health center as per IPHS 2022. So you can see in this table, section 8 service provision includes infrastructure. Infrastructure include general appearance and upkeep of the sub-health center or health and wellness center, sub-health center, general appearance and upkeep. Okay. Then 8.2 human resources for the health services. Then their capacity building, how to strengthen their capacity. Okay. Strengthened under the quality services. Their contact and behavioral standards, how they have to behave to the public, okay, health personnel in the sub-health center. Then safety measures what are the different safety measures to provide for the protection of the health of the manpower or health personnel in the HR department. Okay, human resource health services. Then 8.3 is medicines, related to medicines, and 8.4 related to diagnostic test available in the health center. 8.5 related to equipment available in the as per the standard, as per the IPHS in the sub-health center, and how to maintain the quality assurance, that is 8.6, and 8.7 implementation of IPHS. So there are many criteria for implementation of IPHS. We discuss it in later. So first one is 8.1, that is infrastructure. So if you are going to answer an essay, you can just list down what are the infrastructure is necessary or has to be maintained as per IPHS standards 2022 by sub-health center or health and wellness center, sub-health center. Okay, so under infrastructure, first one is general appearance and upkeep. Okay, general appearance and upkeep. It includes the maintenance and upkeep of the sub-health center or sub-center, wayfinding or signage post. Okay, where is the OP? Okay, where is the lab? Where is the pharmacy, etc. Parking facility. Third one is parking facility in the sub-center or at the sub-center. Garden and green areas. Okay, greeneries in the sub-center. Environmental friendly features. Okay, that includes rainwater harvesting. Okay, using solar, etc. Disabled and elderly friendly access. Okay, elder people or disabled people, what are the facilities available in the sub-center? Okay, that is special facilities in the corridor, okay, in the staircase, etc. So disabled and elderly friendly access, that is 6th. 7th one is disaster and emergency preparedness. Okay, that is what are the facilities available for the disaster and emergency preparedness at the sub-center. Then fire safety, okay, fireproof and fire safety in the sub-center. Electric power supply necessary or needed in the, or what are the services are required for the sub-center. Illumination, lighting, okay, lighting facility in the OP and other areas of the sub-center. Portable water supply, drinking water supply, okay, a facility for the safe and wholesome water supply for the sub-center. Drainage and sanitation facilities in the sub-center. Waste management system, biomedical waste management system in the sub-center. Infection prevention and control, protocol or services, okay, activities. Infection prevention and control. And 5th one is infrastructure for the clinical services at sub-center. So we have to explain again what are the infrastructure necessary to render the clinical services or patient care services, outpatient services in the sub-center. So you can list down all this infrastructure comes under general appearance and upkeep. So there are 15 different areas are covered under general appearance and upkeep of sub-health center under IPHS 2022. Then the 15th point is infrastructure for clinical services. Okay, it includes first one is screening and holding area in the sub-center. Okay, facility for screening and holding area, facility for registration in the sub-center by the OP patients, waiting area in the sub-center, consultation room, OP consultation room, health and wellness area. Okay, and wellness area in the sub-health center, clinical laboratory or laboratory facilities or lab in the sub-center, record keeping room for the storage and maintenance of the records, record keeping, daycare beds. So it is a OP services, but we have to observe the patient, outpatient. For that we need a daycare beds. Okay, or in emergency preparedness also we need a daycare beds. So daycare beds, store available. Okay, availability of the store. Then teleconsultation area. Of course, under Ayushman Bharat there should be teleconsultation facilities in the sub-center. So teleconsultation area. And the 11th point is support services. Okay, we'll explain what are the support services. Then 5th one is oxygen supply and oxygen facilities in the emergency and other routine services. So these are the 12 different points comes under infrastructure for clinical services in the sub-center. First one is screening and holding area. Second one is registration area. Third one is waiting area. Fourth one is consultation room. Fifth one is health and wellness area. Sixth one is clinical laboratory. Seventh one is record keeping. Eighth one is daycare beds. Ninth one is store. 10th one is teleconsultation area. And 11 is support services. And last one is 12th one is oxygen supply. Support services include washrooms for the the patients, then decontamination and washing facilities of the equipment, then residential area for the staff or manpower or health personnel of the sub-center. So that comes under support services. Then under section 8, second one is 8.2 is human resources. Okay, human resources of manpower or health personnel for the sub-center. As per IPHS standards 2022, rural area, rural health and wellness center, sub-health center, minimum 3 people, and urban health and wellness center should have 5 members. Okay, first one is in the rural sub-health center. Okay, health and wellness center, sub-health center, rural area. First is community health officer, CHO. So there should be one community health officer in the rural health and wellness center, sub-health center. Then multi-purpose health worker, that is 2, 1 male and 1 female. So health worker male and health worker female. Then for the sanitation and security services, that can be hired, that can be through rent, it can be, or through contract basis, it can be mentioned, that is outsourced or contract basis. So there should be minimum 3 health personnel or staff in the rural health and wellness sub-health center as per IPHS guideline 2022. In relation to urban area or urban health and wellness center, there should be 5 total staff in the sub-health center, urban sub-health center, that is 3 plus 2. 3 means first one is medical officer, 1 medical officer, then staff nurse or pharmacist, either staff nurse or pharmacist 1, then multi-purpose health worker male 1, okay, multi-purpose health worker male 1. So like that 3, medical officer, staff nurse or pharmacist, and multi-purpose health worker male 1. Then support staff, for example sanitary staff 1 and security staff 1. These 2 staffs in rural area has to be contract basis, not a permanent staff. Okay, so like that in urban area or urban sub-health center, urban health wellness center, there should be 5 staff, okay, health personnel or manpower or human resources. Then moreover 1 ASHA per 1000 populations to support the rural health and wellness center, sub-health centers. Okay, 1 ASHA per 1000 population or 1 ASHA per habitation. Per habitation means if it is a hilly or tribal area. We already said the hilly or tribal area, they cover only 3000 population. For 3000 population there should be 1 ASHA. Okay, 1 ASHA per habitation in, especially in tribal, hilly and other desert and backward area. Then in urban area 1 ASHA for 2000 population, that is 1 ASHA per 2000 population to support the urban sub-health center, and 1 ANM auxiliary nurse midwife for 10,000 population in the urban area to support the urban health and wellness center. Okay, this is about the human resources manpower of sub-health center as per the IPHS standards 2022, both in rural area and urban area. Then under service provision, next one is 8.3, that is related to medicines. Okay, in Annexure 6 it has been clearly mentioned nearly 100 medications has to be supplied or issued from the at free of cost from the sub-health center. Okay, so 8.3 is medicines. So access to essential medicines. So sub-health center should have an access to essential medicine at free of cost by the public. Okay, by the people, those who are visiting the sub-health center as NOP. So the list of the essential medicine also mentioned in the Annexure 6 of the IPHS 2022, and government is giving all these available or essential medicines at a free of cost as per the government initiative, Government of India initiative, that is Free Drug Service Initiatives. So Government of India is having an initiative that is known as Free Drug Service Initiatives, under which all these nearly 100 medicines at free of cost they are supplying, government is supplying through the health and wellness sub-health centers, and the list of that essential medicine is given in the Annexure 6. Then under service provision 8.4 is diagnostics. In Annexure 7 of the IPHS 2022 clearly mentioned the 14 different or important testing facilities available in the sub-health centers. That is especially in the urban health wellness and sub-health center where this medical officer is available. So 14 tests are, essential tests are available at or made available at sub-center or sub-health center. That is clearly mentioned in the Annexure 7. Then under service provision 8.5 is equipment. So Annexure 8 is explained about the different type of equipment has to be maintained in the sub-health center. So the equipment mentioned under IPHS should be included the list of essential equipment at different levels of facilities. Okay, all the list of essential equipment has been mentioned in Annexure 8. Okay, and Ministry of Health and Family Welfare also have another initiative that is called as BMMP, Biomedical Equipment Management and Maintenance Program. Biomedical Equipment Management and Maintenance Programs. So, under which or as per this initiative that is mentioned about how to systematically maintain and monitor the various equipment in the health centers. Okay. For this also the guideline is given in the IPHS 2022 regarding the systematic maintenance and monitoring of the equipment in the sub-health center. Okay, a detailed list of equipment is placed at Annexure 8 of the IPHS 2022. Then under service provision 8.6 is quality assurance, maintaining quality assurance in the sub-health center. So ensuring quality of care is the key component of all the health center under government. Okay, that reduce the gaps of the quality of services, okay, or quality of care in all three dimensions, namely structure quality, process quality and outcome quality. So as you are already maybe studied about the Dona-Badian model of quality assurance or quality of care, that is quality of care has to be mentioned in the structure, that is the infrastructure, and the functions of the staff, that is the process, and outcome patient satisfaction, that is the outcome. Okay, patient satisfaction of the OP services of the sub-health center, everything is clearly maintained and standard is given under IPHS 2022. And moreover, for ensuring the provision of quality, Government of India has a collaboration with other national and international agencies. So Government of India or Ministry of Health and Family Welfare formulated a collaboration with other international and national agencies to ensure the provision of quality of care in the health centers. That is, first one is ISQA. ISQA is nothing but International Society for Quality in Health Care. And second one is Accredited National Quality Assurance. So this is the national level quality assurance agency or accredited agency, and this is the international agency. Okay, so National Health Agency and International Health Agency, ISQA and NQAS maintain the standards or quality in the district hospital, community health centers, primary health centers, urban primary health centers, health wellness centers, sub-health centers, urban health and wellness centers, etc. Okay, this is all Government of India under Ministry of Health and Family Welfare have a collaboration with this international and national agency. Then under service provision 8.7 is implementation of IPHS standards in the sub-health center. For that we have a governance, okay, government control over the sub-health center, monitoring group, continuous monitoring, Jan Arogya Samadi also formed to have a community participation or engagement in the services, in planning and implementing and availing the services from the sub-health center, accountability, okay, responsibility and accountability, patient-centric services, patient-centered services, grievance redressal for the health personnel or the manpower or the staff of the sub-health center to reduce their stress and tension, that is grievance redressal. Then information and communication technology for communicating the information or even for the communication facility, and intersectoral convergence or collaboration and coordination with other health related sectors to provide the quality services. So these are the important points discussed in the IPHS 2022 under implementation of IPHS, that is, one is governance, second one is monitoring, third one is Jan Arogya Samadi, fourth one is accountability, the next one is patient-centric or patient-centered services, then grievance redressal for the staff, then information and communication technology, then last one is intersectoral convergence or coordination. Then regarding the annexes, there are 12 annexes in IPHS 2022. First one is Annexure 1, that is related to Citizen Charter. Citizen Charter is a table in the annexure. Actually, that is a document of commitment which is made by the government to the citizen as per the patient right. So, government has given a commitment in the first paper regarding all the patient rights to have a services, quality assurance services from the sub-health center. Okay, that is Citizen Charter. Annexure 2 is service delivery framework. In that it is clearly mentioned what are the different services are available from the sub-health center. Mainly the available services is 12 packages of comprehensive primary health care. I have already uploaded a video of 12 packages of comprehensive primary health care. You can watch and you can go through with that. That's an important topic. Okay, then other services include outreach linkage with the village health and nutrition day and urban health and nutrition day. Okay, so outreach services, okay, that also mentioned in relation to village health nutrition day and urban health nutrition day. Then the services given by the medical officer at urban health and wellness centers. Okay, so these all comes under service delivery framework. In detail and in depth it is mentioned in Annexure 2. Annexure 3 is having 4 layout or blueprint of the health wellness center and the sub health center. Okay, so how to construct, okay, that blueprint is given. Actually there are 4 layout, that is how to construct a health and wellness center, that is without labor room and with and without residential facility. So with the residential facility and without residential facility, the layout plan or blueprint is clearly given in the Annexure 3 about the health and wellness center, sub-health center. Then Annexure 4 is disaster management and preparedness. So in this it is given how to manage the disaster, how to prepare for the disaster management. Annexure 5 is explained in detail about the roles and responsibility of all the staff of the health and wellness center, sub-health center. In that it is mentioned minimum performance standards, okay, of the human resource. But that is first one is for the medical officer. Medical officer must conduct minimum 75 patient OPD per day. So in OPD he has to see the 75 patients per day, that is mentioned. Then his duties, clinical duties, emergency duties, other duties and supervision of all the programs in the urban health and wellness center. Then about the community health officer in the rural area, that is community health officer, minimum 20 patient per day OPD has to be conducted. So OPD services to minimum 20 patient per day. Then he has to do minimum 40 to 50 teleconsultation services per month. Okay, 40 to 50 teleconsultations. Then is clinical duty, emergency duty and other duties and supervision of all the programs of the rural health and wellness center also mentioned clearly in this annexure. Then staff nurse is given as per the INC norms. Okay, as per the Indian Nursing Council norms, staff nurse has to perform in the health and wellness center. Then regarding pharmacist, minimum 120 drugs has to be dispensed per day. Okay, that is given as per the minimum performance standards, that is dispensation of 120 prescription per day, and he has to maintain the stock register, store and inventory register and inventory management, checking out of the all the articles and equipments and drugs in the health and wellness center. Then last it is given in detail about the job description and the responsibilities of the multi-purpose health workers. Then Annexure 6 is mentioned in detail about the list of essential medicines for the health wellness center, sub-health center and urban health and wellness center. So essential medicines, nearly 100 medicines list, national essential medicine list is given in the Annexure 6. Annexure 7, list of diagnostic test and equipment needed for the diagnostic test in the health center. Then especially that is 14 important essential diagnostic test has to be done in the urban health and wellness center is mentioned in Annexure 7. Annexure 8, list of equipment that is needed for the health center both in rural and urban area is given in detail. Then Annexure 9 explained in detail about the cleaning protocol of the health centers, how to clean the health centers. So water solution is used for cleaning, disinfectants. So cleaning protocols. Annexure 10 is mentioned about the service area wise protocol. Okay, that guidelines for area wise services. Then Annexure 11 is explained about the checklist for daily rounds at the PSC for the monitoring and evaluation of the quality health services. Checklist is given in Annexure 11, and last Annexure 12 is mentioned about the different contributors for making this IPHS 2022. That is a list of contributors of IPHS 2022 is given in detail in Annexure 12. So these are the 12 important annexure has been found in the IPHS 2022. So you should have a minimum knowledge, that's all. If you have a time, you can list down what are the annexes, or you can mention there are 12 annexes, etc. I have been explained to make you to understand all those things that is present in the IPHS 2022 for health and wellness sub-health centers. The next section about the functions of sub-center or sub-health center. As in, I am not going to explain. I have been already uploaded a video in detail about the mnemonics of functions of sub-center. Okay, in that I have mainly mentioned about the 2012 IPHS standards, so that you can write as a functions. So services you can make this IPHS 2022, that is the 12 components of the comprehensive primary health care and others. So far we have discussed in detail about the IPHS 2022, that is Indian Public Health Standards for Sub-Health Center or Health and Wellness Center, Sub-Health Center. Hope this video really benefits in your studies and exams. And if you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next and important academic video.